Hello, everyone. Welcome to Autumn is Here. I'm your host, Francine Crawford, and today we're going to speak to Lisette Armstrong Smith. She is a retired registered nurse administrator, and now she does consultant, and she's going to give us some information on caring for your parent. Welcome to the show, Lisette. How are you today?
Good, Francine. Thank you. It's nice to see you.
Well, it's good to see you again. I thank you again because you've done a show for us before, and your information was so important. And today I want to talk more about just caregivers seeking help or people seeking help for their family. Where do they go? What are the steps and what other programs are out there for them? So first, tell me a little bit about yourself.
Well, I have been working at a home care agency providing personal care service or home attendant service for over 30 years. And I retired back in 2020. And I now work with the agency that I retired from as a consultant. So I try to stay abreast of what's happening in home care. And just want you to know that I have been watching your shows.
Oh, thank you. Thank you.
And it was a great season 1. So I just thank you for having me back in season 2.
Oh, thank you. Thank you. I really appreciate it. And the information, especially, now, you have to keep up on the information because so many things change, so it's good to kind of rehash some things and give people some information about what's out there for the help that they need and to help caregivers and families just to start going through the process. So let me ask you, if someone has a loved one that suddenly took ill, they weren't expecting it, and they may work, the person may work and they can't take care of their parents full time and they need help. Is that where your agency would have come in?
Most definitely. Definitely. But a person would have to apply for Medicaid, the Medicaid program in their state if they don't have Medicaid. Now, there's a difference between Medicare and Medicaid. Okay.
Okay. Explain that, please.
Okay. So both of them are health insurance plans, and they're provided by the state. But the person receiving Medicare automatically gets that after they've been working for a certain amount of years and they retire. And then you're eligible for Medicare. So that's medical insurance from the state that you earn. Medicaid is a medical insurance program also provided by the state, but it's more of an entitlement. So you have to qualify, you have to be eligible to receive Medicaid. And in order for you to get home care long-term, you have to have Medicaid.
Okay.
So it doesn't matter, whether it's a home attendant or personal care service or home health aid service, it's considered long-term care and you have to have Medicaid.
Okay. So what are the steps that someone has to take? They have to apply for Medicaid. And then after that, how do they get help? Do they go to the hospital to get help? How do they do that?
So it really depends on where they're at when they need the help. If they're in the hospital, then you would go through the discharge planner or the social worker at the hospital. And if you don't have Medicaid already, that would be the person that would help get the ball rolling.
Okay.
If you're in the community, you can go to one of the home care agencies in your community that will help you or direct you to where you need to go to social services so that you can get the help that you need.
Okay. So they would direct you to, would it be private agencies?
They would direct you to like the Department of Social Services.
Okay.
To get that help, unless the agency accepts patients or clients with private pay, then they don't have to go that route because they're able to pay for their services, and chances are they're not going to be eligible for Medicaid anyway.
Okay. So Medicaid is based on how much money you have also?
Yes, it does. Yes.
Okay. Okay.
Assets, income, all of that. And then there's a look back period. So, you know, how sometimes the children may take money out of their parents' bank to make it look like they don't have the money that they have, or put the house in their name. But if they've done that maybe in the last 2 years, 2 to 3 years, there's still that falls within that look back period.
Okay.
Okay.
Okay. And is that in every state pretty much they have a look back period? Just
I believe so. I think that's just one of the conditions under Medicaid.
Okay. Okay. So are there different types of care and program and things to receive services to receive?
Yes, it is. And one of the ones, well, I think you've talked about on your previous shows, you discussed home attendant services,
Yes.
which is the same as personal care services.
Okay.
Home health aid services, which is there's a little more that's required from a home health aid in terms of what they can do versus what a personal care aid can do for the person.
Okay, so a home attendant is able to take care of them if they like things like washing their hair or helping them to wash up and bathe and things like that, and helping them around the house. And
Right.
then there's a home health care person that can do a little bit more.
That's a home health aid.
Okay.
And that person is supervised by a registered nurse. So a home health aide can do things like maybe reinforce a client's dressing if they have a wound, whereas a personal care aide cannot do that.
Okay.
Okay. And it's not that they can't do it. It's just that under the law, their certificate does not cover that type of service or care.
Okay. Okay. And is there any other care help that they can get?
Well, you have housekeeping services. I forgot about that. Now,
Okay.
Housekeeping services would just be for someone who's able to manage their own personal care, but they need some assistance keeping the house clean, doing household chores. So that's what, a housekeeper would come in and do that. And usually that service, a housekeeping service, is usually anywhere from 8 to 12 hours for the week.
Okay. 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 Okay.
Okay.
All right.
And then you have your personal assistant,
Okay.
which is in the CDPAP program, which is what we're going to talk about more today.
Can you explain what CDPAP stands for?
Consumer Directed Personal Assistant Program.
Okay.
Now you have CDPAP, which I just said is the Consumer Directed Personal Assistant Program, and you have CDPAS,
Okay.
which is Consumer Directed Personal Assistant Services.
Okay. All right. Go ahead.
And I bet you're going to ask me, what's the difference?
What's the difference?
Hey, okay. So CDPAP is the actual consumer directed program. And when they use the term CDPAS, they're referring to services that are available under that CDPAP program.
Okay. Okay. So can you explain a little bit about the CDPAP program?
So CDPAP program, and you see the commercials on TV talking about Freedom Care. Oh, you can get paid to take care of your relative. Your relative can come in and be your aide. And they hype it up, like it's a really great thing. And it can be a really good program.
Well, it could be a good program, and I guess because it helps in both ways. You have someone that's familiar with you and cares about you that's able to help you, but they're able to actually get paid, if I understand properly. Your family member can get paid for helping you.
Exactly. Okay. Now, people are under the impression that this is a new program. And it's actually not.
Really?
It's not. No. This program started back actually in 1980. In 1980, there's an agency that's still in existence. It's in Manhattan. It's called Concepts of Independence.
Mm-hmm.
And this was like one of the pioneer agency that actually started this program. And it came about from people with severe disabilities that was receiving home care from personal care aides or home attendants. And they would come in, and these people were really not trained to care for someone that needed so much care. And there was no way that the agency could really, spend time just trying to acclimate these people to these consumers. So the consumers got together and they formed a coalition. And in 1997, that was when they got together, they approached their legislators, they went to Albany, and they really fought for this program. As of the year 2000, the consumer directed, hold on, I'm sorry.
It's okay.
The Consumer Directed Personal Assistance Association of New York State was formed. So that was in the year 2000. And it was much cheaper for New York State to provide services through this program because they didn't have to pay the same rate to the personal assistants in this program as the agencies had to pay their certified workers who were trained to take care of clients. So the difference is that the aides in the traditional care program, your personal care aides, your home health aides, they were trained to do specific things. However, with the personal assistant program, the consumer actually trains that they hire them. They're responsible for hiring them. They're responsible for training them to do all of the care that's needed for them.
The person who is in need of assistance trains you on what you need. So you can say, this is what I need. I need you to comb my hair, wash my hair, go grocery shopping for me, and to aid me in certain things. So there's nobody outside that is going to supervise that they can do that.
Exactly.
Okay, so what if you need a little more help, like you just had a stroke or something and you need help balancing or something like that? How do you know if they are equipped to help you in like extra medical assistance?
So I'm glad you asked that question because that's one of the things where it's CDPAP versus traditional care, okay. Right? So under traditional care, if the agency sends in an aide to take care of a consumer, the nurse from that agency develops a care plan for that particular consumer, and they go over that care plan with the consumer and the aide. The aide is only responsible for what's on that plan of care. Okay. And I forgot to mention now, the person that's receiving the service, the consumer, they have to be able to train and direct that aide that they hire.
Okay.
Or they have to have a responsible person to act on their behalf to direct.
Okay.
Okay. Now the assistant that works for them under the CDPAP program may be able to do things like suction. If the person needs suctioning, a personal care aide would not be able to do that.
Okay.
Okay. Changing a wound. A personal assistant can be trained to do that, whereas a personal care aide under the traditional system cannot change a wound. Mm-hmm. So whatever that consumer's needs are, They would be the supervisor. They would be the payee because the money comes to them and they pay their aides. So the agency in under those programs only act as the agent to make sure that money is given for the aid for the work that the assistant did, not to supervise.
Okay. So they interview the person, they hire the person. The person may or may not have any kind of experience in that or not. Am I correct? Okay.
Correct.
They can be your family member. Okay. So now the agency comes in where I guess you would send a report to them that this person has done how many hours, and then you send the report to the agency and they in turn get the money from Medicaid?
So what happens is the personal assistant, when they get to the consumer's home, they would clock in.
Okay.
At the time that they're supposed to start working, and at the end of their shift, they clock out.
Okay.
Okay. There's also tasks that are associated with the care of the client that when they clock out, they would enter the task that they had to do for that day.
Okay.
Okay. And at the end of the week, those numbers are, tabulated, and that's how the agency knows how much needs to go to that consumer so that the consumer can pay the aid.
Okay. So the agency takes the information and sends it to Medicaid, and then they send the money to the agency, or they send the money to the actual consumer?
Send it to the consumer. So they would send a check for the personal care, the personal assistant to the consumer, and the consumer would give that money to them.
Okay. So this is what I want to make clear. Is the agency sending the paperwork to the government for Medicaid, and Medicaid, are the agency waiting to get paid before they pay the person?
No. Okay. The agency is always the one that has to wait to receive, to be reimbursed for the funds. And it's always behind. They're always behind. The state is always behind. Okay.
So the agency just on a regular pay period or whatever, once they get the number of hours, they just issue the money.
They issue the money, right?
They wait for Medicaid to pay them.
Right. So the agency would be paid through the insurance company.
Okay.
Okay. Like Aetna or Health First, or because the client, the consumer is probably with one of those insurance companies.
Okay. So is this part of Medicaid? Okay. All right. So now that they have, if they don't have anyone to regulate it, because the agency is only paying you, the agency is not regulating the care. The agency doesn't send in a nurse supervisor to see if everything is done, because the consumer has already made up what you need them to do. So the agency doesn't even know all the things that they're supposed to do. Am I correct? Okay. So there's nobody making sure that they're capable of doing this, or that they are doing this.
Well, you see, this is one of the things, this is one of the disadvantages, though, because the person has to sign an agreement that the person that I'm hiring has been trained, they know how to care for me, and this is the person that I want to care for me.
Right. Okay.
That relinquishes the agency from the responsibility, and their responsibility is only for payment.
Okay. So just a scenario. If I'm a son or a daughter and I come in, my parent has had this personal care aide for 6 months, and I come in and I notice that they're not doing certain things, I cannot go to the agency and complain. Correct? I have to go to, try to straighten it out with them, because my parent is the person who hired them. Correct? Okay, so the agency has no responsibility in that scenario.
Exactly. So the consumer is totally responsible for teaching, hiring, firing, and getting somebody else. And that also means that if that person that they hired calls out and can't come to work and they don't have anybody else, it's not like the agency can send in a replacement. That's not their responsibility.
Ah, okay.
So that's one of the disadvantages.
Yes. Okay. Okay. That's a lot on, on someone and that needs the help. Wow.
Right. Right.
Okay. So, tell us some more information, some pros and some cons in this program.
Well, the pros are, a lot of times a consumer may be receiving service from a home care agency. Mm-hmm. And, you've heard horror stories. Oh, I can't find my stuff. The aide comes late all the time. The aide goes into my bedroom and I don't want her in there if I'm not in there. I'm missing things. The aide broke my chair. You hear all kind of stories, right? Right. So usually it's a consumer that has already gone through so many aides and they've had enough. And so they change over from the traditional care to CDPAP.
Okay.
Okay. So one of the advantages are, like you said earlier, the person gets to work with someone who they feel comfortable with, who knows them, whether it's a family member, a neighbor, but there are some restrictions though. Okay. So a spouse cannot be a caregiver and get paid.
Okay.
Okay. A parent cannot get paid to take care of their child that's under the age of 21.
Okay.
Let me see. I think there was one more. Yeah, a legal spouse, you're a parent caring for a child under 21, and the person that's the designated representative for the client is not eligible to be their caregiver and get paid. And that makes sense. It's like, one person being the judge and the jury.
Okay.
Can't do that.
Okay.
Okay. How many times have you heard people talk about having disputes with the family and, I don't talk to my cousin anymore. Why? Or I don't talk to my sister anymore. Why? I don't have anything to do with my mother because she's so mean. You hear those stories all the time. So the same thing happens when you have family, or can happen when you have family taking care of a consumer. Mm-hmm. If it goes sour, if the relationship goes sour for whatever reason, who does the consumer have to go to complain? Wow. They don't talk about that. Mm-hmm. Your mother is going to be your mother until she dies, and then she's still your mom, mm-hmm. right? Your siblings are going to still be, your relatives are still going to be related to you. Mm-hmm. But once you get into this kind of relationship, it can get very sticky. And, people just need to be aware of that. Sometimes consumers are talked into doing this type of program. Sometimes, there's jealousy within home care. You have a person who's receiving the care from an agency, mm-hmm. and that aide is doing such a good job, and the family starts to feel, like they're not needed, or, mom never, she never brightens up when I come into the room. You know what I mean? But what happens every time Joan comes in to work for her, she just gets this big, bright smile, and they're in there laughing and talking. So the jealousy happens, and they talk mom into, well, let's do the consumer directed program, because then you don't have to worry about the agency sending you a replacement, somebody that might come in and steal from you. Okay. And then they get their relative right where they want them to be taken advantage of.
So you should be very selective with who you're going to ask to care for you if you're going under this program. And I do understand sometimes people do not want to go the traditional route, or they have been the traditional route of going to an agency and getting a home attendant or something like that. And they're disappointed because sometimes the scheduling, people don't show up, or like you said, some people don't, care for you where you want them to care for you. So I understand how people would get a little bit frustrated over the traditional way and have this other option, consider this other option, like I'll try to get somebody I know. So I understand that. And it's good to have an option, but while you're looking, you have to be very careful with who you select, that's going to do the work for you. And, maybe would you suggest that people would, consider that being maybe a family decision, maybe calling a couple of your family members and say, hey, I was thinking about asking Lisa to do this. What do you think? You know what I'm saying? Is that something, because it's kind of hard. You want the care, you're in need of the care. You're frustrated over maybe traditional stuff, agencies that have disappointed you. And this is out there. But still, when you make that decision, if you're in pain or you're in need, you may make that decision prematurely and not select the best person. Exactly. So it may be better to have someone, even if someone in the field, to kind of give you that overview of the actual program and what can happen, the good and the bad, and what may benefit you. You know what I mean?
Right. And see, I just believe that in order for people to make they need to be able to make a well-informed decision about their care. And that's really why the state really pushes this CDPAP program now. They have to do that because they have to give the consumer a choice in their care. But they don't really sit down and explain the pros and cons to them. They're not going to do that. So unless the person is aware and able to ask these questions, they're not going to know. They're going to learn by it actually happening or hearing how it happened to someone else.
Okay. So I'm curious, is there a reason why, I've just heard about it for the last few years. Is there a reason why we're just hearing about it? Like you're saying, like they formed a group, like 1997 and then in 2000 officially. And how come we're just hearing about it in the last, 6 years or something like that? Was it limited to certain people or certain groups? Was it harder to get into? Was it, regulated in some way that was difficult, and now they're a little bit lax with the requirements? Like, what possibly changed?
So this program was really designed for more people upstate whose parents may have suffered, some type of disability that prevented them from being able to care for themselves. And their children maybe had to take time off from work so that they could care for them because there was nobody else to do it. And so now, these people were home, and it's like, okay, well, if I'm going to be home and I can't be at work, I still have to have an income. So they were able to receive assistance for caring for their parents, as long as they could do that, until they could find somebody that could could care for them and step in, and they could return to work. But then it had to be, they couldn't just offer it upstate. They had to bring it downstate. And, you got a whole nother set of people downstate. So, people get very creative with things that they can do in terms of the program. And right now, there's just so much fraud going on within that program, people collecting money, not earning it because they're not there, or they're there, but they're not really doing what they're supposed to do for the consumer. So who's the consumer going to tell?
Right. There's nobody to go to say, can you make this person do this A, B, C, or D? Wow. That's something that, something to be considered. That's something to be considered.
Most definitely, and that was one of the reasons that, and I thank you for inviting me to come on today to just kind of open up that window to let people know that, what, get more information about this before you jump and say, well, let me take full responsibility for myself, because if people communicate with the agencies too, in terms of their care, and the agency communicates with them, they'll probably have a better home care experience and they won't have to go that route.
Okay. Well, that's interesting. I mean, I'm all about choices, so I'm glad people have a choice. But to make an informed decision on what is best for you, it's always better to make an informed decision and have everything good and bad, so you can make the best decision for you. So, I have a question about traditional. Okay, traditional care. If you are having an issue where people are not able to take care of you properly. Say you get traditional care and you have people who don't speak English, and they're taking care of someone who speaks English, and they're hired to do certain things, but you really can't communicate with them. So how do you deal with that? Because why would you send people out who don't understand English unless they're going to someone who speaks their language? I understand that, to have somebody who speaks your language, and then that's helpful. But for a traditional agency to send out someone who doesn't speak the language, how does that help? How do you deal with that?
Well, unfortunately, there are that scenario exists many times. The agency has to use who they have available. Okay. You can take care of a person. You can do physical things and you don't have to speak the same language. But then it gets to the point where it's very important for you to be able to understand what the consumer needs from you. And, sometimes the agency will have someone else in the agency who's bilingual. Mm-hmm. And if the client needs to call the agency 10, 15 times just to be able to communicate with that person, then the agency has to have, they have to make that available to the person. Okay.
I was just wondering, why do they actually just send them out? But I understand there are certain things that you can do. You can communicate that they can, do things and wash them up and things like that. So I do understand that. But if they are not communicating well, they can call the agency, and the agency can either have a translator for them or have them talk to the person.
Right. The agency also sometimes will have things like a language line where the client can call and they can actually get someone on the line to translate for them.
Okay.
Another option is they have apps on the phone where when you speak into it in English, it translates it into the language that you need it to translate to.
Okay.
And so that's another option in terms of communication. But it's just still, it can be very frustrating to somebody who's receiving the care, right. Who just doesn't, it's like, I just want to be able to tell you right now what I want. I don't want to have to deal with, right. And especially with our seniors, they don't want to go through all of that.
Right. They don't.
And really, since the pandemic, there's a shortage of aides across the board. I mean, people are leaving the profession.
Wow.
They just don't want to be inside anymore because, it's like we had to go through COVID and all of the restrictions and people getting sick and, aides going into a home where there's other people that live in the home besides the consumer and they have company and you got people gathering and it's difficult.
Right. Well, I appreciate the people who do it. And I understand everything, especially in the healthcare industry there after COVID, we've lost a lot of professionals and things like that. So it has made these jobs more difficult. Overall, can I just ask, since you've been in the industry for so long, what are the things that you think that should be improved or can be improved upon, if anything?
Well, first, just on a personal level, I am not an advocate for CDPAP.
Okay.
Not an advocate for the CDPAP program. When I did work at the agency, we declined from being included in that program. And, it was a difficult decision to make because we were actually losing clients to CDPAP because we were not, we weren't a part of that program. But we had people consumers that wanted to come back to us after their family taking care of them for a little while. They weren't pleased. Okay. And they felt that at least at the agency, they had an ear that would listen and that would be able to do something for them, which we tried to do. So, that was one thing. I think the aides need to be trained better to go in and do what's needed to make the client feel comfortable enough that they don't mind having the agency send someone to them as opposed to having a family member. Mm-hmm. And I think it's important too to support, the agencies have to support the aides more.
Okay.
Appreciate them more, show them some appreciation, have something, which I know the agency that I'm consulting with now, they did something recently that was so appreciated from the aides. They had aides come into the agency and they gave them certificates for a job well done. They had food for them. They had them invite their families to come. And they were just so thankful that, somebody recognizes the work that I do every day. Because, see, remember, they're not in the office, so you don't see what they're doing. They're in the client's home. We don't know when the client calls them off hours outside of their shift because they have a problem or they're lonely or they just want to vent about something that's been going on with them, So you got to uplift your workers that on your frontline workers, we call them.
Okay. So support and training can be improved. Okay. Sometimes it's the little things and appreciation. Right. And right. And it is a hard job because you don't know who you're going to get, what type of person you're going to get or the needs, and then some people who really want to do this and they have the heart to do this, they care, so they do a little extra, and no one sees that. The office doesn't see that, So yeah, I do understand that. So, okay. Well, thank you. Thank you for speaking to us on Autumn is Here. Thank you for giving us some insight into caregiving and the programs that are out there. We just want people to make a wise decision, give them as much information as they need just to help them in making these decisions as you grow older, something to consider. Even if you don't need an aide or a home attendant now, consider it, look into it, see what it's about, and then maybe you can make a better decision when it's time when you may need one. So that's what I just want to get the information out there. And I just appreciate you spending the time with us and just always enjoy talking to you. And thank you again for just taking the time to spend on Autumn is Here.
Thank you so much for having me, Francine. And it was a pleasure being here. And I just encourage you to continue doing what you're doing because, like I said before, I've definitely enjoyed the shows. I just don't stop. That's all. Just keep going. Keep going. No matter what, just keep going.
Okay. Okay. What do they say? From your mouth to God's ear? Okay.
Exactly.
Okay. All right. Well, I will keep that in mind. Okay. But thank you again. This is a wealth of information and it's very needed. It's very needed and it'll help somebody, I'm sure.
I hope so.
Okay. All right. Have a good evening.
You too. Bye.